Thank you, Vicky. Much appreciated. And it's great to be back at REBA again. So if we go to the next slide, a good place to start, obviously, is we all know the challenge in terms of the health that we face in the marketplace, in the and the everyday working life. If we really focus in on the act bonding, if we go to the next slide, please, we've got 63% of employers are really seeing the need to expand these wellbeing strategies despite what we're seeing in COVID. And in fact, a very consistent message that we're seeing is focus on both physical and mental health working together to achieve performance. And there's been a lot of talk, obviously, about the impact on mental health with lockdown and the various events around COVID, but also the science is emerging about the importance of physical resilience and the physical state of health in order to protect us from COVID as well. So clearly we're in a position where inaction is actually likely to have a negative impact. It's really important for us to develop our thinking in terms of how to optimize well-being in our populations. Now, in doing that, if we go to the next slide, we have to acknowledge that businesses are very, very different. Do you have a very office-based business? Do you have a lot of manufacturing? Do you have a distributed workforce? Do you have contact centers? And there's a real challenge to how do we personalize and adapt this approach to well-being on a company-by-company basis. Now, if you go to the next slide, we've been looking at the various data sources, and actually only just over half of you feel that you can actually interpret and understand the impact of wellbeing programs. And what we did was see that just a simple guide on the right, we sort of rated the kind of metrics and measures. So the number of stars is how useful, and the color is how easy is it to get the data. So generally, yes, we can get participation rates, we can get some awareness engagement, but not that useful in really understanding the health benefit. That's fundamentally important. If we're really going to deliver an effective wellbeing program, I think one of the biggest lessons this year is we've got to demonstrate an improvement in health. And we're very interested in looking at risk reduction, because I think that's showing the physical and mental resilience of the workforce, but there's still many, many other aspects. So how we use this data to establish goals, define the metrics, and set the milestones is ever so important. So what I want to do is hand over to Dr. Steve Iley and let him share the experience within Jaguar Land Rover about what they did within their workforce. Steve, over to you.
Thanks, Chris. So hopefully what we can do today is talk a little bit about Jaguar Land Rover and our experience, and really share with you what we learned, what went well, and some of the areas where we're still working to improve. Who is Jaguar Land Rover? Hopefully you all know our cars. We are an international company, so we have a presence in 127 countries. We manufacture, so we have factories or engineering in 9 countries. In the UK, we have about 31,000 people, and we have a big spread of people. So we have engineers, we obviously have manufacturing, but we have all the other support areas that are necessary to both build the car and get it to market and make sure that it is safe, effective, and a quality product. In the UK, we do have a predominantly male manufacturing workforce. That does vary by jurisdiction. So in our Slovakia plant, we find that we're much closer to a 50-50 split, male-female on the line. And we have 2 peak age brackets between the 30s and the 50s when we were doing some hiring as we expanded. Within our manufacturing colleagues, which is about 20,000 people, the main issues that we see, which wouldn't be a surprise to those of you who know what a manufacturing organisation looks like, is musculoskeletal. Musculoskeletal issues remain the main cause of our occupational health referral. But when we look at our absence statistics, actually it's mental health. So as Chris said, mental health is very important to us. As I'm sure it is to many organisations in the UK and indeed globally. And mental health actually is the issue for absence, but musculoskeletal, we are able to keep people at work or prevent them from going off. When we look at our statistics around what the causation is for mental health, we can see that about a quarter is due to external factors, about a quarter is due to something work-related, and about half is a mixture of the two. It's very difficult to pull out what it actually is. We also see the prevalence of the risk factors that you see in the UK population: smoking, obesity, overweight, and sleep. When we start to think about supporting our employees, we wanted to have a strategy that was going to resonate with many, many different people across the organization. We had to be able to touch all those different people, and we wanted to link it to the purpose. The purpose of Jaguar Land Rover is experiences people love for life. And so our well-being vision was very much in support of the purpose, and then developing the strategic pillars around mind, body, and life. Mind, body, and life based on the biopsychosocial approach that we needed to look after the person in their entirety to be able to get the best out of them and support them. It's no point, in our view, in ignoring the fact that there's something going on at home and not being able to support them in that, because that thing at home may cause them to be absent, which doesn't actually help us or the individual in the long run. So we wanted to look at how our mind, body, life approach could really make sure that we were able to do the holistic approach. It was all staff in all shifts at all locations. We had to engage by site, country, and we had to look after the well and the unwell. So we wanted to make sure that there were proactive elements for those people who were well, and also for those people who felt unwell or were at risk of becoming unwell, there was support there for them. Equally, we wanted to make sure that it was both for managers and employees. As a manager in a well-performing and well team, health-wise, they had to have things that they could use to support their team and improve the engagement and overall, hopefully, improve the efficiency. At the same time, if the team had an individual who was unwell, we could target that. And bringing that all together to make the positive changes in their health, we were aiming to not only improve their health outcomes, and as Chris says, trying to make sure that we target that specific health outcome we felt would lead to an improvement in engagement levels and a targeted absence risk reduction. So the byproduct was absence risk reduction. The primary goal was an improvement in health outcome, which led to an improvement in engagement. We needed to focus on participation and accessibility. Our early research told us that we had many services already in place, but actually our employees, our colleagues didn't know about them and certainly didn't engage with them. So we used the same principles that we use for our customers when we applied to our wellbeing program, which you can see on the slide. It was very much a multimodal approach. So we really tried to pick out things that we thought would resonate to make it easy and accessible for the customer and also deliver what they needed. A lot of our colleagues don't have a work email, particularly in the manufacturing environment. They don't sit at a computer all day. They're on the line, they're building the cars. So we need to be able to make it easy for them. We use an app, Your JLR app, and we use an open source wellbeing website, Jaguar Land Rover Wellbeing, both of which you can go on and have a look at after the talk. They're completely open source deliberately because we wanted to remove the need for anybody to have to put in a password or use a Jaguar Land Rover computer. That wasn't going to work for us. The full health journey had to include suitable interventions to make sure we could both look at thriving and those who needed help in the time of need. So we use that day in the life approach about, are you thriving, or are things not quite right, or are you starting to struggle, or indeed, are you really struggling? And then we directed the employees using very simple tools and graphics to some of those support tools. You can see the Thrive app in the middle covered both struggling and things on the mind. The mental health training for managers we used very much at the forefront. And we were able to produce some critical data that really started to show the difference. And when we think about training in particular, I think one of the challenges is the data is lacking. So it's very difficult to actually get data and prove that you've made a difference. So we started to look at, when we trained our managers, what difference did that make? We could analyze for the trained managers, the difference between the first day of absence and sending in an occupational health referral actually was much, much better. And the number of referrals for employees who were absent were better. So we're starting to prove that training the manager makes a difference, particularly in mental health. So that sort of data and that response on the ROI, the return on investment, is critical when we talk to our finance director and the board about why they should invest in these types of programs and expand the training out. So we've got a target to do all our managers by the end of this year. When we look at how we engage, we have to engage in a way that makes sense, both on the site and for the employee. We've already talked about the fact that our sites are different. We can have an office-based site and they need certain things. We can have a manufacturing site and they need certain things. And using that data, whether that be from the kiosks or from our health MOTs or from what we've now been doing for the last 6 months, which is assessing people for their COVID risk, we bring that all together and start to analyze and produce for a site what their local site needs are, so that we can start to say to a site, you've got a very specific need in X and we would like to support you with this specific program. So some things we do globally, some things we do nationally, some things we do locally by site, and we use the data from any source we can lay our hands on to try and bring that to relevance, both for the employee and for the managers in that site. And we're starting to make a difference. You can see that our health and wellbeing scores have improved over the last 4 years, and we're really pleased with that. It shows that we're going in the right direction. We've got more to do, but we're on a journey, and we will get there with the support of colleagues, giving them the right tools. I think when we look at where we're going, we want to accredit. We know that accreditation helps the sites and our colleagues identify a goal and work towards it. So we're in year 2 at the moment, where we're making sites bronze for engagement, and you can see that as we go into years 3 and 4, and indeed into 4 and 5, we go from silver to gold, with reductions in some of the specific metrics and improvements in other metrics to give goals and aim to get there eventually for all sites. Our absence is getting better, and we're really pleased with this. So ultimately, we've made a difference to the thing that some of our managers care the most about, which is our absence statistics. So all sites have started to now come down, which is great, and we want that trend to continue as we aim towards getting our absence down to the lowest level possible. But that's a secondary figure. It's more important that we touch the engagement and work to improve the health of our colleagues. Reinventing for tomorrow, it's all about looking forwards, using what we've learned from COVID and keeping our focus on the engagement to get to that gold standard. Chris, back to you.
Thanks, Steve. So really just to draw out the key points on the next slide. Obviously, leadership is key here because we're creating new models, we're creating new ways to support our colleagues to help them be the best they can be. So that dynamic between yourself setting the agenda and working out what are the particular needs of your organization across physical and mental health are tremendously important. And also the thing is, because it spans physical and mental health, it is a key foundation for that positive work culture. So in terms of, it's not just a physical assessment of health, it is the whole atmosphere at work can be influenced by your wellbeing program. And finally, of course, you have a lot of your people, the way they perform, the building is worth investing now because these are the people who are going to be the leaders of tomorrow. So thank you. I'll hand back to Vicky for any questions.
Pack into a short time. So I just wanted to get straight to questions because we've got a few minutes left. Just looking at the poll where you asked the audience to rate wellbeing programs' ability to measure and show success. Looking at the results here, we've got 36% of people felt it was poor, 45% okay, 16 said it was good, and 3% said it was great. I just wondered what your thoughts were on that and if that was what you were expecting from that poll.
So I guess we're still learning, I think, about wellbeing programs, as Steve said as well. So it's great to we've got 3% that they've arrived at. Fantastic. I think there's an ambition that we can definitely progress and improve.
Is there anything you would add, Steve?
I don't think that is a surprise, the statistics. You know, most people are on a journey with their wellbeing programs. Very few of us have got it absolutely spot on and right, and we consider ourselves to be gold standard across the board. So we're all somewhere in the journey from learning to doing to trying to well.
Okay, brilliant. Now I've got a few more questions coming in here from Jane Austin. What mental health training did you provide your managers with, as we're not wanting to go forward with mental health first aid?
Yeah, good question. I think for us, it was about identifying a training that fitted our population. We have manufacturing managers, some of them have come off the line, so it needed to be relevant. Giving them training that they don't like, we know from past experience really doesn't work. So we chose a training program that worked for us. We've actually shifted it from face-to-face to digital. That was always the plan, but COVID actually speeded that plan up for us, and we found the acceptance of that to be pretty good. So we don't feel we've lost a lot by molding the training to make it digital rather than face-to-face, but the content was key. So although mental health first aid is something that we have looked at, we looked at training that made more relevant, particularly to the manufacturing managers, that suited our particular style and community.
Great. I've got another question here from Debbie Fennell. How do you get a predominantly male audience to engage with Thrive?
That was a real challenge. We've learned that certain things tick their box, so we have to make it something that they work on and agree with, and we found that actually telling them that this was about supporting their colleagues worked well. So rather than saying this is for you, we said this is for your colleagues, your workmates, the guys you've been standing on the line next to, in some cases 20 years. If you look at this and if you use this, you might be able to help them when they're in a time of need, because you're going to see it before we will. And you're going to know they're having a problem way before they ever get to occupational health or probably even their manager. So we actually did it as an indirect about use this to help support your colleagues.
Brilliant. And another one here from Stephanie Bullock. Did you see any spikes in absence or change of reasons initially when you raised awareness and increased the conversation, particularly around mental health?
We didn't. So we didn't see a spike in absence, but I think that was probably due to the fact that our absence wasn't coded accurately. And that's probably due to the fact that people are still reticent to tell us the true reason why they're off. So we know that absence is often hidden behind another reason, be that multiple short-term absences, and they might call it gastrointestinal, or they might call it something else. So our absence overall didn't change, but we did start to see a subtle shift in the way it was coded by our clinical professionals.
Brilliant. I'm afraid we're almost timed up there, so I just wanted to say thank you both for really fascinating insights there, particularly around what you're doing specifically at Jaguar Land Rover. I'm sure much of the audience are really enjoying hearing about that work that you're doing and how you've been approaching it. Okay, right. Well, we'll be back in a couple of minutes on Live Stage 1 and Live Stage 2 with our next speaker sessions. And remember that you'll need to go to My Itinerary on the left-hand navigation menu to access your next session. See you soon.